All right, let's get right into it. Today, we're talking about a topic that has a ton of curiosity around it, and maybe a little bit of mystery too, the so-called male G-spot or P-spot. Our mission? To separate the facts from the fiction and get to the bottom of what's really going on here. So I'm guessing you've probably heard this term thrown around, right? It pops up all over the internet and, it raises a lot of questions. Is this a real thing? Is it just a myth? Well, that's exactly what we're here to unpack. Whenever this topic comes up, the same few questions always surface. People want to know, is it actually safe? Are there any real medical benefits? Can it, improve pleasure? And what about all that talk about helping an enlarged prostate? We're going to tackle every single one of these. So let's start this journey of sorting out what's a myth and what's the real deal. The goal here is to give you clear, straight-up information, no hype, no nonsense. But before we can even think about answering those big questions, we got to start with the fundamentals. A little biology 101, if you will, because understanding the actual anatomy is the key to understanding, everything else. So welcome to Anatomy 101. Our focus today, the prostate gland. Getting a handle on its size, where it is, and what it does is absolutely crucial if we're going to make sense of this whole conversation. So this is it. The prostate is a pretty small gland, about the size of a walnut, but its location is everything. It's tucked right below the bladder, and it actually wraps around the urethra. That's the tube that urine flows through. And its placement is exactly why it's tied to both urinary and sexual functions. So what does this little gland actually do all day? Well, it's got three main gigs. First, it makes a special fluid that's a huge component of semen. Second, that fluid is designed to help nourish and protect sperm. And third, during an orgasm, the prostate contracts to help propel semen out. So yeah, it's a small but mighty important part of the system. But what does it feel like? I mean, how do you make this anatomy idea more real? Well, it's often described as feeling smooth and rounded, kind of like the tip of your nose. It's a surprisingly simple way to help picture something you can't see. Okay, so now we know what the prostate is and where it lives. The next logical step is, how does stimulation even work, and are there different ways to go about it? And this is where we need to be really clear. There are two very different approaches. On one hand, you have internal stimulation, which is the only way to directly touch the prostate. On the other hand, you have external stimulation, basically pressure on the perineum. Now, that area has a lot of nerve endings and can feel good for sure, but it does not physically reach the prostate itself. That distinction is super important. All right, now we're getting to the heart of it. We're going to tackle those big questions we started with. Is this whole thing about pleasure, or is it some kind of medical treatment? This is where the hype and reality often collide. Let's tackle the first major claim head on. There's this idea out there that prostate massage can help with enlarged prostate, or BPH. But when you look at the actual science, the evidence just isn't there. There's no solid proof that it shrinks the prostate or helps with urinary issues. In fact, if there's any inflammation, it could actually make things worse. And this slide really says it all. The amount of strong scientific proof that prostate massage is a medical treatment for BPH, it's zero. A big fat zero. It is not a recommended therapy for this condition, period. Okay, so if the medical claims are basically a bust, what about the other side of the coin? What about pleasure? Let's be honest, this is probably why most people are curious in the first place. And the answer here is, it's complicated. For some people, absolutely, yes. It can be incredibly pleasurable and even lead to more intense orgasms. But, and this is a huge but, it is so individual. Some people feel absolutely no added benefit, and that's perfectly normal too. The most important thing to remember is this: it is not a magic button. There's no guarantee. So if curiosity leads to exploration, then we have to talk about safety. And this part is the number one priority. It's completely non-negotiable. Let's walk through the absolute must-know rules. First off, let's be crystal clear about who should avoid this entirely. If someone has an active infection like prostatitis, or they're experiencing severe pelvic pain, fever, rectal bleeding, or, and this is a big one, has known or suspected prostate cancer, this is off the table. A doctor needs to be involved, period. And for anyone else, these 4 rules are the law. 1. Consent. It has to be clear, enthusiastic, and ongoing. 2. Go slow. We're talking about very delicate tissue here. Gentleness is everything. 3. Lubrication. Use lots of it. Seriously. And 4, the most important rule of all, if there is any pain, you stop immediately, no exceptions. Okay, we've covered the anatomy, busted some myths, and laid down the crucial safety rules. So after all that, what's the bottom line? Let's boil it all down into the key things you really need to remember. Here they are, the 4 big takeaways. Number 1, it can be a source of pleasure, but it's definitely not for everyone. Number 2, those medical claims about helping an enlarged prostate, they're just not backed by science. Number 3, this is absolutely not required for healthy or amazing sex life. And finally, if it is something you explore, safety, comfort, and consent are everything. They always come first. And really, this is what it all comes down to, isn't it? There's no rule book for what a person should enjoy. The whole point isn't about chasing some myth you read online. It's about understanding your own body. So forget the trends. The only thing that truly matters is discovering what works safely and comfortably for you.